Good morning, students. Previously, we had discussed about Costa Rican experiment and Kerala experiment. Today, we are going to see some realities of healthcare facilities in India. Nowadays, if you open up any newspaper or news channels, we hear about Corona. Corona has exposed the weakness of Indian healthcare system. We cannot blame anybody as such because number of the patients coming to the hospitals are beyond calculations. So arranging the facilities in ICUs and in hospitals is beyond control. Public health facilities are not able to provide as the people expect. And if we move into private healthcare facilities, the expenditure is beyond the control of many people. The insurance schemes are very less, or less number of people have insured themselves for any kind of medical reimbursement. So it is unwanted. We hear the cry of relatives of the patients, the anger of the relatives of the patients, the expression of helplessness by the doctors and nurses, the angry reactions and response of many people. But nothing can be done by you. So this is at least the time to think about our healthcare facilities. Do we have sufficient doctors? Do we have sufficient nurses? And do we have sufficient infrastructure facilities for treatment? In corona situation, nurses and doctors are helpless. Many of them are dying. They cannot do anything. Recent news about Bihar, Patna Institute of Medical Science. Many doctors were affected. So those things are there. So now let us just at least see some infrastructure, or how many beds are available in India, how many hospitals are available in India, like that let's say. See, private hospitals are more all over India, that we know, and more number of private hospitals are said to be located in Uttar Pradesh because Uttar Pradesh is naturally thickly populated or more populated state. Since population is more in Uttar Pradesh, naturally hospitals should be more in Uttar Pradesh. So that is, and naturally private hospitals are in more number than the government hospitals. Really speaking, should have been just opposite, but this is not. So let's see now. According to the government, there are 37,725 facilities. What are facilities? Primary health centers, community health centers, sub-district or divisional hospitals, and district hospitals. If we take all these three along run by the government sector, it comes to 37. When it comes to the private, it may be around 3 times of this. Then there are hospitals run by defense. There are hospitals run by railways. Then there are hospitals run by industrial units. All those things are also there. But still these facilities are not sufficient because of the corona. Otherwise, okay, there was no much. Still, situation was fixed. This is who is responsible. The government, according to the elective principles of state policy of the constitution, it is the responsibility of the government to provide good health facilities to the citizens, good environment for them to live, provide good medicines for the people. Now vaccination is going on. The people who are between 45 to death all are given vaccination, all are permitted to have vaccination free. Now government has announced on 1st May onwards, above every citizen above 18 years of age are entitled to get. Every citizen above the age of 18 is entitled to get vaccination. And it can be purchased from private firms. Government, state government may procure and give you. Central government may procure and give you. The confusion is who will be providing it. State government or central government, what will be the money to be charged, fees will be charged, or not. Little confusion is not clear. Different state governments are ready to order, and government has told that even the medicine companies like the Serum Institute and Punawara both have told they will have different prices for state government, central government, and private hospitals. Like the different prices. The confusion is not very clear, 100%. Like for the citizens, government may be having clear idea. We, the citizens, are not coming to a clear-cut ideology or idea how it is going to be distributed, how it is going to take place. If all the people are rushing to the school hospitals where this medicine is said to be free, it will be difficult for the government to manage. So that it depends on the organization, the planning of the government to provide the medicine to the people in ward ways, panchayat ways, or something like that. If they divide and inform the public that this is available in these days, that may able to control or bring the things to all the people. Vaccinations. Each ward, panchayats are there. So if the panchayat is organizing, each panchayat is going to submit because of population medicines, because government is having data of the population in that area. And among that, how many have taken population data is there. That data can be utilized. And each panchayat would be given the medicines. So if it is coming there, done under the control of the government organized plan, then there's a chance medicine or vaccine reaches to every citizen without too much problems. And there are people who are reluctant to take also. In that, there will be rumor also. If we take this is going to happen, that is going to happen. All those things the government has to face it. Some people will not be ready to take it. Recent news is there from Israel. Israel has provided around 50% vaccination, so they have permitted the people to move around the places without a mask. So in Indian population, but Israel population is around 1 crore. We are having 130 crores. If Indian 50% of population to be vaccinated, it comes to around 65 crores of people to be vaccinated. So even vaccination has not crossed 1 crore to 1.5 crore. So it is not easy. Hearing 1 crore is easy, hearing news, but the reality when it comes down to the people to distribute among the people, it is not easy as you think. The systematic, corrected, calculated facilities are needed. And modern period we have computer systems to identify material has gone to which place, where it has taken and all those things. So tracking, providing, everything is okay. We can sit in a particular area and even concentrate. State-wise, district-wise, panchayat-wise we divide, and ward-wise the materials are divided. I think that would reach all the citizens of India, and vaccination would be very good for us, so that the coronavirus will be out of India. It can take place. Let us hope it would take place. So that is the situation. So then all the facilities, hospital facilities may be sufficient, because persons who are taken virus vaccine, it doesn't become serious. It is not 100% study, but doesn't become serious. So the available around 4% of the total people already are getting this. Even second occurrence they are having is only 4%. So it is manageable with the infrastructure and hospitals available to us. So vaccination is the only solution to bring the things into control. So in India, private healthcare services are increasing, but public healthcare services are not. This is a problem of India, because the cost is very high. So people are not ready to go to private healthcare. They may not having that much money. So it's naturally people are. So it should be public healthcare should go ahead. Government should stop all public healthcare and hand over the entire system to private healthcare and implement insurance to every citizen, equal insurance to every citizens. Whoever get a treatment will be reimbursed. So get out of the healthcare system by the government. Government only coordinate in the vaccination or like that activities. Government will not interfere into the day-to-day medical things. But entire payment should be done by the government through the insurance, not by an ordinary poor person. He may not be able to bear the expenditure it is. Lakhs and crores, he cannot bear it. So government should take our vaccinations, our medicine systems, and through the insurance systems. Vaccination or providing health insurance or information, research work can be concentrated by the governmental sector. So it is a responsibility of the government to provide equality, because quality service will come if it is there only. Now quality service, we know the government facilities are not so much attractive. Hospitals are not neat and clean. People are not happy to go there. So infrastructure facilities should be developed. Latest equipments may not be available in district hospitals or taluk hospital. Even medical colleges of government may not have the latest technologies that are utilized in the medicine field. All medical colleges are not there. So that must be changed. All citizens, especially the poor and the disadvantaged, also are eligible to get good health facilities, because they are citizens of India. They have an equal right. So it is the responsibility of the government. So the Kerala experience I have already explained to you. So everywhere, every nook and corner, I told you there is a hospitals are there, doctors are available, nurses are available, vaccination even itself is easy to conduct, ward division, all those things is easy. The system is well organized and well set up. Facilities are available. It is not necessary from 100 kilometers, doctors and nurses should reach in the villages. In the villages, the facilities are. Only the medicine packet has to reach you. No new persons. But in other states, maybe persons from the village cities have to go there. They have to educate the people and make them vaccinations. So that is the situation that has to come in the realities. Okay, thank you very much. God bless you.